It's time now for your Mowery Moment, brought to you by Mowery Clinic in Salina. Since 1934, Mowery Clinic has generously given back to the local community, sharing its time and resources with our area schools, charities, and businesses, proving time and again that you matter more at Mowery.
That's right. It's time for your Mowery Moment, and we are joined today by Dr. LaVelle Ellis, a gastroenterologist for Mowery Clinic here in Salina. Dr. Ellis, let's get right to it. I think it's safe to say that getting a colonoscopy isn't exactly that appointment on the calendar that people are necessarily looking forward to. Can you tell our listeners why these procedures are of such vital importance to their health and their well-being?
The great thing about colonoscopy as a colon cancer screening tool is we can actually prevent cancer. So it's one of those few screening things we do where we know the precancerous lesion, and when we do the colonoscopy, we can remove that polyp or remove that growth, and so colon cancer then will never grow at that polyp site. So it's a great preventative screening thing to do for your overall health. The sedation works wonderfully well. We're very well versed, very well experienced. It'll be a comfortable experience, I promise, and something you're probably only going to have to do every 5 to 10 years. So if you put it in those terms, not that bad once every 5 or 10 years.
Now, people commonly associate colonoscopies with gastroenterology and vice versa, but you guys do way more than that.
We do. Basically, a gastroenterologist is a specialist in the digestive system. So we deal with everything from heartburn or acid reflux to gallbladder disease, liver disease. We see a lot of patients with abdominal pain. There's just a lot that we specialize in and see patients for.
So really, folks aren't necessarily always looking forward to meeting you, but after they've had an opportunity to be treated by you, it's a completely different ballgame.
Well, we hope so, and especially with the colonoscopy, that nice sedation, usually we're still friends afterwards.
Fair enough. Now, Dr. Ellis, when you're off the clock, how do you like to spend your time away from Mowery Clinic? I know the life of a physician, very busy, but I'm sure you get a little bit of free time to enjoy.
I do. My faith is very important to me, so I enjoy a lot of things at church, Bible study, and small groups. I don't want to offend anybody, but I'm a huge Broncos fan. I love KU basketball. One of the most rewarding things I do is I volunteer at the shelter. I'm a member of the Friends of the Salina Animal Shelter, which is just a fantastic group of volunteers. And my favorite volunteer activity is as a foster parent. So I actually foster for the shelter. And right now, for example, I have a mama cat and 6 kittens at my home that are waiting to get old enough that they can be adopted. So that's a really rewarding experience.
That is fantastic. And as a fellow Bronco fan, you're always going to have respite here at the Rockingham Media Studios in Salina. And thank you so much for taking your time today, coming down here, sharing with our listeners a little bit about what the Mowery Clinic team of gastroenterologists do, and for letting our listeners know the doctors at Mowery Clinic do such a great job of not only taking care of their patients, but really giving back to the community.
We hope so. That's sure our intent.
Thank you again for your time.
You're welcome.
This has been your Mowery Moment, brought to you by Mowery Clinic in Salina. To learn about all of the services Mowery Clinic provides, go online to MoweryClinic.com or give them a call at 800-223-0845. For medical care, you matter more at Mowery.